Of course, dental care was just one priority that New Democrats put on the table in return for supporting the minority Liberals. And to talk about dental care, we're now joined by the NDP's health critic, Vancouver Kingsway MP Don Davies. Mr. Davies, good to see you again.
Great to see you, Michael.
Now, listen, long before your party signed the Supply and Confidence Agreement, New Democrats did introduce a private member's bill for a national dental care program. Why was it so important? Why is it important for your party?
You know, I can really trace that back to the 1960s, Michael, when we were creating our Medicare system. Dental care was supposed to be part of our public health care system, but it wasn't at that time because we didn't have enough dentists. And Tommy Douglas in the 1960s said that our dream was head-to-toe health care, so all aspects of it delivered through our public health care system. So it's long been part of the NDP DNA. And the NDP, we were alone pushing this issue on the national agenda. We introduced motions in previous parliaments to have universal dental care available to everybody, and frankly, the Liberals and Conservatives both voted against it. So that's why it was important to us in the Confidence and Supply Agreement to make progress on this. And you know, 32%, that's 1 in 3 Canadians, about 13 million Canadians, don't have dental insurance. And to us, dental care is primary health care. It's not a luxury. It's not a cosmetics issue. It's a matter of fundamental health. And if you don't take care of your mouth, it leads to serious health problems. So we're really excited that we forced the government to act on this issue. Okay,
so now here we have it. Enrollment essentially begins now up until 2025. Is this the program that New Democrats had envisioned?
Yes and no. I'm very happy with the design of this program. It's a comprehensive basket of services, just like a normative dental plan. Everything from x-rays and fillings and bridges and dentures, you know, tooth extractions, gum surgery. Everything's going to be included just like anything else. So I'm happy with that. I'm fairly happy with the fee schedule, because making sure that the dental professionals are happy about this is key to the success. I guess where I'm left a little bit yearning is it's our dream to make sure that everybody has coverage through our public health care system. So to us, this is a down payment on that, a very important one. But you know, this is going to change a lot of people's lives, Michael. I mean, you know, seniors who can't bite into an apple, single moms who can't get their kids to the dentist. This is going to be a life changer for them, and also in a time of great affordability issues, it'll take some much needed expenses off people's pocketbooks at a really important time when people are struggling.
Okay, so I hear what you're saying about you see this as a down payment for more down the road, but I do wonder, are you at all concerned that this new national program will encourage provinces to cut back on their own programs or companies to cut the dental insurance available for employees right now?
Well, fundamentally, no. I mean, that's a legitimate concern, but I don't think so for a couple of reasons. You know, provinces and territories are going to sit back and watch while the federal government pays 100% of the cost of covering their residents, their citizens, to get dental care they don't get now. That'll keep those people out of emergency rooms, out of hospitals, because that's where they end up when they don't get access to dental care, saving provinces and territories money. So I think it's a win-win for the provinces and the federal government and territories. In terms of businesses, you know, the most employers provide a basket of services in an extended health plan. They include physiotherapy, pharmaceuticals, massage, and dental care, including cosmetic services. So I think extracting just that one piece of dental care out of those plans will be difficult and not very attractive for a lot of employers. And of course, one thing I don't like about this plan, but is a realistic aspect keeping businesses in, is the means test, right? This is only for families with income under $90,000. A lot of employers cover their employees who make more than that, so it's not feasible for them to drop their plans and have their employees covered by this one.
Mm-hmm. Now, before you go, of course, I'm going to ask you about pharmacare, because the week did start out with me reading an article saying that you were still holding out hope that maybe something might be introduced before the end of this week. Do you still have that hope?
Well, it's looking dimmer all the time. I did at the beginning of the week think that it's possible. We're in very, very intense and close discussions with our Liberal colleagues, and we're exploring some really interesting ideas to advance the idea of public single-payer pharmacare. So I'm going to work as hard as I can to the end of the deadline, and hopefully that we can get something done, but if not, I'm going to keep at it, because that's also another extremely important healthcare need for Canadians.
You know, what's interesting is, and you and I were talking about this during your party's convention in Hamilton, just how important it is for you and for New Democrats that pharmacare is essentially is a public system. But here you have dental care relying on an insurance company. Is that a type of compromise that we might still see in pharmacare? Is that still a sticking point here?
No, you won't see that in pharmacare. I mean, too much work has been done, Michael, and research and studies on pharmacare, because we know that the only way you get the efficiencies, the effectiveness and the fairness of pharmaceutical coverage is if you fold it into our public system. We have decades of research showing that. The thing about dental care is we don't have that work being done. So that's why the NDP said, look, we don't mind making a down payment on universality for dental care and get 9 million Canadians covered now, and we'll continue our work on that. But for pharmacare, you know, after the Hoskins Advisory Committee report and the report we did at the Health Committee, there's just simply no doubt that that's the only way forward is to fold pharmaceuticals into our single-payer system. So that's a non-negotiable for us.
Is that still a major sticking point, though?
Well, our position couldn't be clearer, and you'd have to ask Liberals what their position is. You know, it was Prime Minister Trudeau, after the Health Committee issued our single-payer report, which was by a majority Liberal committee, by the way, his answer was to kick that off to the Hoskins Committee. He created it and asked for Hoskins' advice. The advice came back, do single-payer. So, you know, it's a no-brainer to me. It's the only way you save money and cover everybody. So we're going to keep telling Liberals that and hope we can get a piece of legislation that reflects that and makes progress.
Don Davies, always appreciate the time. Thank you for this.
Thanks for yours, Michael.